Welcome to part 2 of the inflammation module. In part 1, we had a closer look about the various processes involved in inflammation. Now we're going to look at specific Metagenics formulas which you can use to help deal with the different kinds of inflammation. So let's start with acute inflammation. Examples of this would be a sudden injury, a sprained ankle, slipped disc, or something of the sort. Protrypsin is a proteolytic enzyme formula that provides premium-grade chymotrypsin and trypsin, which has been carefully manufactured in a controlled environment to ensure optimal enzyme potency. You can use 2 tablets up to 3 times daily. I would start at the higher end for at least the first 3 days post-injury and then gradually reduce the dosage. It's important to take the tablets between meals and not with them, as otherwise their anti-inflammatory effects will be negated because the enzymes will be used to digest food. So this bottle of Protrypsin comes in a bottle of 60s, and as mentioned, the dosage is 2 tablets. In flavonoid intensive care combines a variety of botanicals and Ayurvedic herbs that provide relief from muscle pain by supporting a healthy inflammatory response. The herbs include turmeric, ginger, boswellia, and cayenne pepper. It also contains lemon bioflavonoids, vitamin C, and quercetin, which protect connective tissues from oxidative stress. This is an excellent formula for people experiencing pain following exercise or physical exertion. The dosage is 2 to 6 tablets daily in divided doses, and we have 2 sizes available, a 30s and a bottle of 90s. Acute phase combines 3 formulas in one convenient package to provide comprehensive support for acute injury. It is best administered in the first 72 hours post-injury and combines protrypsin and in flavonoid intensive care, as well as MyoCalm, which is a blend of bioavailable calcium and magnesium with the calming herbs passionflower and valerian. So that is added to help with muscle spasms. Each container of acute phase contains 9 dose-ready packets, which is great for convenience and compliance. So one just needs to take 1 packet which contains all 3 formulas 3 times daily between meals. So now let's consider the treatment options for chronic inflammatory conditions. Here I'm talking about conditions like osteoarthritis, autoimmune disease, allergies, inflammatory bowel disease, and rheumatoid arthritis. Remember, with chronic inflammation, we want to get to the source of the inflammation and address the various triggers. So a nutrigenomics approach will consider 3 important aspects. We need to look at the diet and change the dietary signals that are promoting the inflammation. Next, we need to work upstream of prostaglandin E2 synthesis by modulating the specific kinases that impact NF-kappa B, an inflammatory mediator. And then we also need to add nutrients that support an anti-inflammatory effect in the body. Medical foods, when combined with dietary modification, will work together to not only alter health, but disease initiation, progression, and severity. While conclusive research has shown that selective kinase response modulators can reduce inflammation by modulating specific kinases. Add to this specific nutrients which have anti-inflammatory properties, and we have a highly effective strategy for dealing with chronic inflammation. The medical foods Ultra Inflammex and Ultra Inflammex Plus 360 work to change dietary signals in favor of health. These medical foods alter dietary signals and calm down inflammation. By utilizing low allergen macronutrients like rice protein, rice syrup solids, rice bran, and combined with olive oil and medium-chain triglycerides, they provide comprehensive nutritional support. Specific nutrients in Ultra Inflammex calm down gastrointestinal inflammation, and support gut barrier integrity. These nutrients include glutamine, rice bran, vitamin B5, zinc, and medium-chain triglycerides. The medical foods also provide antioxidant support to protect against tissue damage from free radicals, which are produced as a result of the inflammation. Key nutrients and phytochemicals in the Ultra Inflamex support and balance the inflammatory process. RIA, reduced iso-alpha acids, is a hops derivative and is one of the actives present in the Ultra Inflamex Plus 360. It works to modulate kinase signaling and reduce inflammatory compound production. The anti-inflammatory nutrients ginger, rosemary, turmeric, and D-limonene are actives present in both versions of the Ultra Inflamex. And as you can see, they have various activities with regards to inflammatory compound production and arachidonic acid release. These medical foods can accelerate the results by working on multiple mechanisms simultaneously. Low allergenic macronutrients calm down the gut-associated lymphoid tissue. Herbs and nutrients heal and calm down COX and LOX enzyme pathways, while SCRM technology in the Ultra Inflamex Plus 360 modulates inflammatory signals. Use the Ultra Inflamex Quick Start Guide to take you through the dietary guidelines, which will support the program. Selective kinase response modulators, or SCRMs, work upstream of COX-2 enzymes and can modulate cellular signals. Here you can see how the SCRMs derived from hops, your RIA and THIA, are able to impact PI3K, gamma, and delta. These are two kinases involved in inflammation signaling. In an animal model, the SCRM THIA was able to reduce arthritic pain and stiffness in a comparable fashion to celecoxib, a prescription NSAID, anti-inflammatory drug. Quite uniquely, it was also found to reduce joint degradation. Therefore, the SCRM's RIA and THIA reduce inflammation and maintain joint tissue better than other approaches. Here you can see why. If you recall, one of the problems with conventional pain approaches is that they block both constitutive and inducible COX pathways. RIA and THIA, referred to on this slide as META-050, are selective kinase modulators that only act on the inducible COX pathway, thereby providing relief from pain without the side effects. Here you can see a tabulated comparison of our SCRM, META-050, versus placebo and two other well-known pain medications, one of which has been taken off the market due to severe side effects. The results obtained with our formula is even better and completely safe. This technology has many years of clinical research behind it, with numerous published studies in a variety of journals and 2 pilot clinical trials determining efficacy and safety. In addition to that, the formulas have been used extensively in the management of various chronic inflammatory conditions at our Functional Medicine Research Center, the research arm of Metagenics. The results that have been obtained are quite phenomenal. This patient with a 15-year history of osteoarthritis used 2 soft gels daily. And at 6 weeks, you can see she had significant improvements in pain, stiffness, and overall function. This summary of clinical experience from the FMRC, the research center, shows tremendous improvement in patients with autoimmune conditions whilst on an anti-inflammatory medical food and a SCRM formula. We have a number of options with regards to our SCRM formulas, and these include Ultra Inflamex Plus 360, which provides RIA, Caprex and Caprex AI, which provide Thea in combination with some other natural compounds which enhance their activity. Caprex is indicated for the management of any inflammatory condition, specifically osteoarthritis. One typically uses 2 soft gels per day, taken with food, but can increase that to 3 if the patient does not respond adequately. Caprex comes in a bottle of 60. The Ultra Inflamex Plus 360 combines all of the anti-inflammatory nutrients of the regular Inflamex medical food together with the SCRM property of RIA, making it a very comprehensive approach in dealing with many of the factors that drive inflammation. It is a great choice for inflammatory bowel disease and autoimmune conditions. As mentioned earlier, it is advised to use this in conjunction with an anti-inflammatory eating plan, as well as the program guide, which directs you as to how to slowly introduce the medical food and gradually build it up to the maximum dosage. Please ask your AmiPro rep if you would like, if she can provide you with a program guide. It comes in 2 flavors, namely Original Spice as well as the new flavor Orange. The Caprex AI stands for autoimmune and has added nutrients like vitamin D, zinc, selenium, which support and balance the immune system. It is indicated for conditions such as fibromyalgia, rheumatoid arthritis, and lupus. It also comes in a container of 60s, and dosage is 1 tablet 3 times daily with food. I'd also like to highlight that these SCRM formulas are contraindicated if the patient is using blood-thinning medications like warfarin. Now we know that specific nutrients can be used to balance inflammation. Here you can see that vitamin D deficiency has been linked to autoimmune conditions, and this review states that increased vitamin D intake could decrease the incidence and severity of autoimmune disease. Its benefits, however, are numerous and include protection from cardiovascular disease, cancer, diabetes, and infections. Doctors are finding vitamin D deficiency is quite prevalent, and as much as 30 to 50% of the general population is low. It is quite easy to incorporate vitamin D3 into your therapy. And the Metagenics range has a number of options. D3 1000 provides 1000 international units in easy-to-swallow micro tablets. It is available in a bottle of 60s or 120. D3 2000 is a complex that delivers 2000 IUs per tablet and includes the isoflavone genistein, which can help to facilitate the body's utilization of vitamin D. This comes in a bottle of 90. D3 5000 features 5000 international units of vitamin D3 in an easy-to-swallow soft gel. It's also in an oil-solubilized form for better absorption in the digestive tract. This is a very easy way to address depleted serum levels of vitamin D. This also comes in 2 sizes, a 60 and a 120. One needs to check serum levels every 2 to 3 months to ensure that levels of vitamin D remain within the optimal range of 50 to 80 nanograms per ml. Typically, patients will need 2 to 5,000 IUs per day to achieve optimal levels. Remember that anything higher than a 1,000 IU dosage needs to be recommended and monitored by a practitioner. We saw in part 1 that a deficiency of EPA, a component of omega-3 essential fatty acids, and too much arachidonic acid can drive inflammation and pain. Unfortunately, our diets have way too much omega-6 and way too little omega-3, and this imbalanced ratio also drives inflammation. One can therapeutically use omega-3 oils to reduce chronic inflammation, as they reduce inflammatory compound production and increase the production of anti-inflammatory resolvin and prostaglandin E1. Metagenics has a range of oils which offer purity certified essential fatty acids. What this means is that our oils, which are obtained from a pharmaceutically licensed manufacturing facility in Norway and which have been approved by the Global Organization for EPA-DHA, are sourced from a reputable source, ensuring the highest quality of raw materials. The fish are not farmed, but rather wild, deep-sea caught fish, and the oils are obtained from a variety of fish species, from larger fish like tuna and salmon to smaller ones like anchovies and herring. Furthermore, our oils are tested by an independent testing laboratory, Eurofins, that screens the oil for over 200 contaminants, 6 different heavy metals, as well as various microbiological contaminants such as yeasts, molds, and bacteria. We can therefore proudly say that our oils are safe and efficacious, as well as being stable, to ensure that your patients get only the goodness and none of the fishiness. To assist in patient compliance, all of our formulas are lemon flavored. In addition, we also guarantee that the EPA DHA content for our various formulas is accurate, so what it states on the label is what is contained in the product. If you recall from part 1, the EPA component of omega-3 oils has more of the anti-inflammatory effects, and so in this formula, EPA 500 concentrate, we provide a concentrated source of EPA in a 6:1 ratio to DHA, thereby maximizing the benefit of the anti-inflammatory effects of the EPA. In addition to this, it is an enteric-coated capsule which allows for the active ingredients to be delivered directly to the site of inflammation in the gut and also reduces the likelihood of burp-up. Certain probiotic strains, such as the Lactobacillus plantarum 299V, have applications for pain and inflammation. Ultraflora Intensive Care contains the LP299V strain in a potent and stable formula. Although it is a refrigerated probiotic, it is stable at room temperature. One capsule provides 18 billion colony-forming units, and because of the high potency, one only needs to take 1 capsule per day to achieve the therapeutic dosage. A bottle contains 40 servings. So in summary, a comprehensive approach to managing chronic inflammation would be a 3-tiered approach. First, use an anti-inflammatory medical food to change dietary signals in favor of health and to also initiate gut healing. Ultra Inflamex or Inflamex 360 are options here. Incorporate SCRMs, such as the ones present in Caprex, Caprex AI, or Inflamex Plus 360, that can modulate inflammatory kinases. And then finally, use key nutrients like vitamin D, EPA 500 concentrate, and specific probiotic strains like Ultraflora Intensive Care to calm down inflammation and optimize the immune response. This comprehensive protocol is excellent for patients in pain, with gastrointestinal distress, with autoimmune diseases, or diagnosed inflammatory bowel disease. This 3-step approach will address multiple mechanisms simultaneously, which results in much better outcomes for your chronically inflamed patients. Thank you very much.